demonstrate the process of taking on and off personal protective equipment, also known as PPE, when caring for residents that may have or been near to someone who has COVID-19. You must wear these if you are doing personal care, meds, feeding a resident, or not able to sustain a distance. The supplies you will need are gloves that fit appropriately, an N95 mask, a face shield, a trash can, and along with hand sanitizer. Notice she has no jewelry, bracelets, or a watch. She has no earrings and her hair is appropriately pulled back. Fingernails should remain short so the virus isn't stuck under your nails. Men will need to be clean shaven as the mask will need to be fit snugly to your face. Before putting on any PPE, you must wash your hands. When donning or putting on protective equipment, you will start with your face mask. For the N95, you will want to cup it in the hand and have the two straps facing downward. Put it onto your face, pull the top strap over the back of your head near the top. Then pull the lower strap over and bring that down to the nape of your neck where you don't have any hair. Be sure the straps are flush. Now we are ready to mold the mask to the face, which is really important because you need to have a good seal to protect from the virus. The molding process starts at the nose. Push and mold it along the nose with 2 fingers, then move around your face to make sure there is a solid seal, which is why, men, you cannot have a beard or you will break that seal. The next part is to check if there are any air leaks. To do that, you will need to place both hands completely over the respirator and exhale and feel if there's any air leaks around the mask. If you do, you need to readjust the mask so there is no air leak coming in and out. So now you are masked up, molded, and sealed. When you put the face shield on, you will need to assemble it. It comes like this. You will need to bend the elastic back to create a round shape. Put the foam part of the face shield above your eyebrow. Bend the elastic back. If you need a better fit, you can pull the straps at the side. This gives your face the most coverage to the front and sides of your face. You'll notice that her eyes, nose, and mouth are fully covered. The last item is putting on your gloves. If you will be handling bodily fluids, put on a second pair of gloves that you will remove after. That way you will have a fresh set of gloves to continue with other care. Now you are ready to enter the bedroom. While you are in the bedroom, you shouldn't readjust the mask or your face shield as this is the highest risk area. If you do touch your face shield or your mask, you will need to disinfect and start again. Next, we will show you how to doff or take off your personal protective equipment. Take your time as this is the time where you are most at risk of spreading the virus. First, throw your gloves away in the bedroom. Remember not to touch the outside of your gloves. Use your thumb to pull it off. You can now leave the bedroom. Go straight to the bathroom without touching anything. You must wash your hands for 20 seconds. Next is removing your face shield. You are going to reach up behind your head, grab the band of your face shield, pull over your head, and remove the face shield from your forehead. Place it on a clean paper towel. Wash your hands for 20 seconds. Put on a new pair of gloves. You will clean the face shield after every use. First, you will wet a paper towel, then put soap on it. Carefully wipe the inside, followed by the outside. Throw that away. Next, you'll carefully wipe the outside of the face shield using an EPA registered disinfectant wipe or spray with hydrogen peroxide. Spray the outside with hydrogen peroxide 6 to 8 inches away. Wait for at least 30 seconds to disinfect. Wet a paper towel, then wipe off the outside of the mask, or the face shield, to remove the residue. Dry with a clean paper towel. Make sure it is fully dry. You will then put the face shield in a plastic freezer bag where it will be stored. It should have your name on it and should not be used by anyone else. Remove your gloves and wash your hands for 20 seconds. Next, you will remove the N95 mask. When removing the N95 mask, always remove the lower strap first and then the upper strap. That prevents the mask from flipping forward onto your face. When you are not wearing it, you will store your mask in a paper bag labeled with your name that only you will use. Put on a surgical mask, which you will be wearing outside of the resident's bedroom. After you have doffed your personal protective equipment, you should always wash your hands with soap and water. If you choose to wear the face shield and the N95 mask in the house, you are able to do that. However, it is mandatory that you wear both of these during personal care, at the mealtime, and each med pass. Otherwise, you can return to wearing a surgical mask. Thank you for watching Because I Care.